There are many people involved in our mission, and it is my privilege to introduce one of the key components of this fight. It is Dr. Paul Sondel. He is the Director of Research at UW Carbone Cancer Center and American Family Children's Hospital in Madison. Thanks for chatting, Dr. Sondel. It is an honor to be chatting with you today. And just let me say thank you for all you have done in our fight to get rid of childhood cancer.
Well, it's a real privilege to be here today and to thank you and the many individuals involved with the MACC Fund that are playing such an important role in making progress possible.
So you're a Milwaukee guy. You went to Nicolet High School, and then you graduated from UW, and you've pretty much been there most of your career, haven't you?
All but 5 years. I came to UW in 1968, and in 1969, I had the good fortune to join the research laboratory at age 19 of Fritz Bach, who had just done the world's first successful bone marrow transplants here at UW-Madison. It was fascinating work, and it was work that helped show that the bone marrow transplant worked to help children with leukemia by giving cells from the transplant donor to the patient. And as a result, those cells killed the leukemia, and that's how it worked. And from there on, it looked like it might be possible to use immune cells to have an impact against cancer. So I finished with him, went off to medical school in Boston, and in the middle of medical school, I realized that the work I'd been doing with Dr. Bach in Madison was even more cutting edge in the area of transplant immunology and anti-tumor immunology. So I went back and finished my PhD with him in Madison, then finished medical school, and ended up coming back to University of Wisconsin for clinical training and joining the faculty in 1980. But all the work that I've done since joining the faculty is really linked to those ideas that started with the first bone marrow transplants done here at UW, and the idea of using the immune system to kill cancer.
So you've been doing it since 19 years old. You have been part of this, like you started seeing this vision.
Absolutely. And back when I was a boy, diagnosis of cancer in a child was virtually a death sentence. And when I was entering college, a bit of good progress was showing up in the realm of chemotherapy and bone marrow transplant. But the majority of children with cancer being diagnosed in the 60s clearly died of their disease. And because of progress since then, we're now curing 80% of children with cancer. But we've got a lot more work to do. We need to provide cures for all children, and we need to make those cures easier for the children and the families to tolerate. In particular, the mainstays of our therapy currently have been chemotherapy and radiation therapy. And while we can use those to provide cures for 80% of children with cancer, those therapies can cause some long-term side effects. In particular, they can cause damage to vital organs, to cause needs for transplants in the future for some children. And for others, those children are at greater risk for developing second cancers earlier in life because of the genetic damage that can be caused by the chemotherapy and the radiotherapy. So our vision is to use the immune system, the same part of our bodies that protects us from viruses or bacteria, but get that to turn against the cancer. And in doing so, cure more children that aren't being cured with current treatment. And maybe more importantly, use that to gradually chip away at the use of chemotherapy and radiation therapy to be able to cure children without these lifelong risks due to the chemo and the radiation.
That's amazing. Not only to hopefully cure it, but to do it with less side effects. So in the little bit of time we have left here, are we close to curing childhood cancer, and how is the relationship with the MACC Fund and Women for MACC helping you with that?
The first question is a complex one. The answer is we're actually curing children with cancer, and we've been doing it for 50 years, but it's just some children. And every year we're able to say we're curing more and more. I do think it's realistic to say we are not that far off from being able to cure all children with cancer. And that's part of the goal. But we want to cure all children with cancer and to do it in a kinder, more specific way, a more intelligent way that gets at the cancer but not the normal cells. And the role of the MACC Fund has just been incredible in enabling research here in Wisconsin, particularly in Milwaukee and in Madison, to do cutting edge kind of research. The kind of grant work that the MACC Fund allows enables us to do risky projects, new ideas that might seem a little bit out of line from what others have been doing previously, but to ask tough questions and see if we can make some progress. And in doing so, we can then take that progress and use it to get funded by the National Cancer Institute to do even more work. But the funding of the MACC Fund gets us started on these new projects, and it enables us to do the clinical research that's so hard to find funding for. So I really want to thank all of you that are here at this event today, and the MACC Fund itself that's been providing this critical research since 1976 and has been doing so in a larger way virtually every year. And it's not only impacting children of Wisconsin, but the research that's coming out of Wisconsin is having an impact on childhood cancer treatment around the world.
Dr. Sondel, thank you, to your team, and everything that you guys have accomplished and are going to be accomplishing in the near future. Thank you.